Okay, good morning, everyone, and welcome to day 2 of the 2025 NAMI New Hampshire Annual Conference, Cultivating Hope, Together We Grow. Thank you for joining us. And if you're new to NAMI New Hampshire, we are so glad you're here. If you're a longtime member of the NAMI New Hampshire family, thank you for coming back. NAMI New Hampshire is a grassroots organization that provides support, education, and advocacy to individuals, their families, and loved ones impacted by mental illness and suicide in the Granite State. We do this by offering a variety of programs and events, including today's conference. I'm Michelle Watson. I'm one of your co-hosts for the conference, along with my coworker, Deb Jerkois, who's behind the scenes doing a fantastic job. Although all of our sessions focus on messages of hope, some people may find some parts of the sessions difficult. If you do, please reach out for support to NAMI New Hampshire's information and resource line, or if you need crisis support, please call or text 988. If you have any technical difficulties, please reach out to Raven at the number on the screen. All conference presentations are in a Zoom webinar. There will not be an option to turn on your camera or microphones. You may have also noticed that we have turned off the chat feature because it can be sometimes distracting. We do welcome questions, so put those in the Q&A and we will do our best to get to all of them at the end of the session. We would like to express our sincerest gratitude to our sponsors who help make today's conference free of charge. Our Hope sponsor is Johnson & Johnson, and we will share a recorded message from Ward Bennett of Johnson & Johnson at the end of the closing session tomorrow afternoon. Or no, it's today, this afternoon. We'd also like to thank our generous and supportive workshop sponsors, New Hampshire Community Behavioral Health Association, WellSense Health Plan, and AmeriHealth Caritas, New Hampshire. So now to get things started, I'd like to introduce NAMI New Hampshire's Executive Director, Susan Stearns.
Good morning, everyone. It's a pleasure to be with you, our NAMI New Hampshire family. And we have a limited time this morning with Commissioner Weaver, so let's jump right in. Lori Weaver is the Commissioner of the New Hampshire Department of Health and Human Services. With more than 28 years of experience with the department and a strong focus on working collaboratively across all levels and functions, other state agencies, and external partners, Commissioner Weaver has demonstrated leadership and success in achieving shared organizational goals and objectives. Here at NAMI New Hampshire, we can truly attest to that, and we're going to talk a little bit about some of our collaborative work this morning. Welcome, Commissioner.
Thank you. I'm very honored to be asked here again today to meet with you and be a part of this conference. Susan and I were reflecting a couple minutes ago that this is actually the third time. So all 3 times virtual, but this is the first time they're actually in the same space virtually, which I think is kind of cool. But it's also reflective of the work that we've been doing together. So what we wanted to focus our time on today was, rather than in the last couple of years, I took some time to share what the department was doing, what we laid out in our strategic plan, some factual kinds of things. We'd really like to focus on what's been going on in the last 18 months and like to frame that up around our initiative called Mission Zero, which is to eliminate emergency department boarding, as well as making improvements in the system of care and for behavioral health services. So really excited to be able to share with you some progress, things that have worked, and areas of where we're going. And before I get started, I just wanted to say that I know that the governor is coming later this afternoon to speak with you, but I had promised her that I would personally relay the message that I met with her the other day, and she was very, very excited about this conference and honored to be asked to be a part of it. She was actually asked to be a part of it this morning, but we have governor and council this morning, and given that she's the governor, she really can't miss that. So she'll be here this afternoon. So, and I think it's great that you have that level of support. So with that, keeping with the theme of Together We Grow, when we look at Mission Zero, really it's about celebrating our progress together but with a focus of different voices in the same goal. So when Susan and I were sort of reflecting on, our message today, yes, we have the same goals, but we have different responsibilities and action items to get through those goals and different voices and perspectives to that. So we took our time this morning to kind of chunk it out into 4 areas for you to really do an overview of the initiatives, making the investments. What investments have we made as a state in behavioral health? Honoring the power of patient perspective and input and how critical that has been in the work that we've done together. And then, of course, looking ahead as to what's next. So with that, ready to dig in. So Mission Zero, some of you may be familiar with this or may not be. We actually have called it that. It was about 18 months ago. We're about 18 months into this initiative. And it's really a call to action with a collaborative spirit to get things done. It's sort of that get it done attitude. What do we know where the vision is of where we need to go? How do we get it done? And we have actually seen significant progress in many of the areas that identified for improvement. But what I want to point out is, again, the Together We Grow. We have various stakeholders that have come together for this initiative. So NAMI is one of them, the department, AKA the state, is another. Our New Hampshire Hospital Association, our community mental health centers, providers in the community, not always agreeing with how the system was working. So we took all of those folks that have varying opinions and often conflict, and we put that group together and started marching forward. And was it difficult? For sure it was, but it's been productive, and we want to keep riding that momentum that we've had. So it's Mission Zero is, yes, it's about eliminating emergency department boarding, but it's really about the people in our communities. And it's really about making sure that people get the right services at the right time. One of the things that we did last fall, which is about a year into our Mission Zero, was we put together a video for this, for our stakeholders to basically say, look, this is what's been going on with Mission Zero, but more importantly, this is the impact of it. And I wanted to take a couple of minutes to share that video with you this morning, so that you could get a sense of, rather than, me or Susan telling you about it, how people have been experiencing it. So if Patrick is ready with the video, it's just a couple of minutes to be able to share that with you. Thank you, Patrick.
No matter what kind of situation you are in, whether it's in the ER, it's easy to lose hope. And when you lose hope, it's hard to continue on. I, at one point, didn't want to continue on in life, and I didn't have a path forward and a purpose in life. But through wonderful people and through the help out there, I found the path forward. And I'm here now.
I have a picture that I keep on my wall that a patient drew for me, and he said that this is what it feels like to get stuck in the emergency department. And this is something I probably look at every day just as a reminder that we need to do better for these patients.
I think for a long time, when we've been looking at how we board in the emergency department, how we serve people who are in crisis, we've done that kind of from our own silo and our own spot.
Everybody came to a realization that we need to work it out, and we need to change the situation, no matter what the challenges are. And I think there was an agreement on that.
Just to realize that there's a normal conversation that we can have amongst the clinical leaders of all these institutions, so that we can make the most sensible decisions for patients and for our staff, that I knew something special was happening here. It was something that was new.
The collaboration of all the entities who are involved in the system, the communication with the other DRFs, the EDs, the community mental health centers, and everyone else in the community who's involved in our system. I think it's something that's been lacking, and having that ongoing communication and collaboration, I think, is a huge success.
And being able to rely on each other and get feedback and recommendations, and sharing their experiences and their their mission to take the best care of each particular patient that comes into their facilities.
I think that Mission Zero has given us a roadmap, as well as this deep commitment throughout our state to work together collaboratively to address one of the more difficult problems that we have.
We've been able to clarify some processes. We've been able to regularize and harmonize the communication. And I think that is an amazing impact because it required literally no other resources than our brains in sitting down and agreeing with a culture of acceptance that we are all in it together.
I would say that one of the most defining moments was the several days, I think, that we had 0 people in the queue.
And the impact that it has had for me as a nurse is seeing people come in as soon as possible to get the care that they need. And that's huge.
One of the most important impacts of Mission Zero that I hear from families like mine, people who have a loved one living with a mental illness, is finally, there is hope that this will come to an end and that all of our loved ones will be able to access the care they need when and where they need it.
Clearly, building more capacity for inpatient psychiatry is a priority. With our unit, which is slated to open later this year, our newly renovated space will allow us to care for a greater number of patients. It will allow us to accept patients on involuntary status, and also to care for a greater number of patients that have medical or surgical comorbidities along with their mental health needs.
I think that's my hope, is that the collaboration and the initiatives that we've already started will continue and only strengthen in the future.
I would love to see Mission Zero succeed in creating resources in the community which would divert patients from hospitalization.
In a situation, in a crisis where they might be automatically sent to the ER and end up in a hospital, we can mitigate that and give them the support that they need in the community to deal with whatever they're going through. It's just a matter of, do we have the people who are willing to do the work to help those who are struggling?
I mean, of course, my main hope is that Mission Zero will put itself out of business and that we will no longer have the issues that we see, both for adults and children.
Well, as in all of medicine, in mental health care, our job is to make our jobs obsolete.
It sounds corny, but the sky's kind of the limit, what we can accomplish.
So I hope that there will be a consistent push, uniformity of an idea, and together we'll do it because we are Mission Zero.
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 We are all Mission Zero.
So that gives you a little bit of insight that we really are Mission Zero. It does take everyone's effort. Just a couple of things I want to highlight there is that Mission Zero is not just on the front end. It's looking at folks that are coming into the system, maybe folks that are leaving higher levels of care or needing transition in between care. So we really focused on 6 different strategies that were referenced a little bit here in terms of what are the community resources that we have, so that we're keeping folks out of that don't maybe need higher and level of care, but do need care, what's available to them. So we have, obviously that front door is what we call our care traffic control. We're really looking at all of the entities involved, if somebody comes into the system in crisis, all of the pieces that need to fall in place. So it's not just the state, it's not just the hospital, this is the patients, the insurance, all of those pieces, how do they line up so that folks aren't sitting there waiting? So I would just say to you, some stats that we have over the last year and a half is that the number of days waiting in an emergency room has dropped over 50%. As part of our efforts. And the numbers on the individuals on the wait list has dropped about 43% since we've started. So we're really looking at the last couple of months, we've seen several days of hitting 0, which is fantastic. We do have, it ebbs and flows, but on average, we're down 43%. We're not seeing wait lists of 70 people. We're seeing wait lists of anywhere from like 5 to 10. And then that queue is getting cleared every single day to be able to hit that 0. So that's some great, remarkable progress that has been done. We have expanded, as referenced in the video here, some of the beds capacity so that there was a little bit more, as sometimes there's been construction concerns for some of our other facilities. So trying to make sure that we don't have less beds and not overbuild beds, but make sure that we have flexibility to manage the capacity that we have. But other things like before looking at hospital level of care is a place to go, really what we call like a crisis stabilization center. We just had a grand opening that Susan and I were at a couple of months ago up in Plymouth that our Lakes Region Community Mental Health Center has put up, which is really about that space to go where maybe you don't need to go to the ED and maybe that you can get your needs met there. And it's a place that you could stay up to, I believe, 23 hours. So getting some help and some support and potentially even referrals to other sources of care. Also, we're looking at our community certified behavioral health clinics. So it's really about integrated care. So again, it's about that prevention, primary, getting it ahead rather than addressing it when somebody's completely in crisis. Are there things that we can be doing from a primary care prevention side of it? So we have 2 in the state right now. We're looking at standing up a 3rd this year. It's a pretty big deal. We're really looking at, we have some federal money to do that, looking at the impact that that's going to have in the system as well. Just a couple other things I wanted to highlight. We do have a program that I don't know what's going to happen with our new budget, but the landlord incentives program. And that's really about folks coming out of a high-end acute care, let's just say New Hampshire Hospital, and working with our landlords in the community to be able to offer residences to folks coming out of care and incentivizing them to stay with these folks so that there isn't there's something that happened, they're going to get kicked out or evicted. This would allow them to stay. So I don't know if you want to talk a little bit about how we've involved patient voice in there.
So we've, I want to say, first of all, thank you, Commissioner, for your leadership. Commissioner Weaver has been leading the charge on Mission Zero from day one, and she attends every meeting of the steering committee that I sit on, which, you're a very busy person, so I recognize it shows your commitment to this issue. And in addition, under your leadership, we have seen more, even more desire and active solicitation for that voice of lived experience. So we were thrilled when you were seeking to have someone from NAMI New Hampshire on the barriers to discharge planning work group, and that our peer support recovery supervisor, Brett Smith, was able to join that and bring that really important perspective of his, and he has that perspective as a person with lived experience, but also as someone who has become a leader in our state in this work. So we truly recognize that you and your team are working very hard at transforming our systems so they meet the needs of people with mental illness and their loved ones.
Thank you. The making the investments part, the last thing I just want to add for this section is the state invested in Hampstead Hospital. So it's been a little bit of a bumpy ride standing up Hampstead Hospital, but we're in a state of steady at this moment where we own the facility and we've leased our practitioner care, our clinicians model, our medical model, treatment model is run by Dartmouth Health in conjunction with the state. So the state is a partner in running that, but pretty much Dartmouth is running the clinical care for that. So the advantages for that, for folks in the state is the ability to expand programming, to go beyond just inpatient hospitalization, things like partial hospitalization and outpatient program, really diversify the programming. But additionally, if you've ever been to Hampstead or been familiar with it, the facility is outdated. It's a great building. It's got great bones, but it needs a facelift. It needs some modernization. And this agreement with Dartmouth will allow us to do that. So we're really excited about the space being updated, which is going to make a difference and have an impact on patient experience for sure. Speaking of patient, I think honoring the perspective of patient input and family input. One of the things I wanted to share with you, and Susan, I know has some examples as well, but New Hampshire Hospital has started a patient family advocacy group. Everything has a committee, everything has an acronym, the PFAC. But basically capturing the voice of patients and families with what happens in particular at New Hampshire Hospital. So that could be basically the handbook, how do things go here? How do I know who to call? Who's who? What do I do? Informational materials regarding admissions and discharge. But also, really importantly, we do a lot of patient satisfaction surveys. So a lot of patients help us look at those surveys, and if they're not up to snuff, or if there's things that need to be improved, helping us make those improvements, helping and drive that. But this group is also really critical. For a real life, I think another Together We Grow experience. We had the unfortunate event that happened on 11/17 a year and a half ago, where we had the hospital shooting, and there were safety recommendations that came out of that, that the state was basically told to comply with. And these were not easy recommendations. You can't just say, I want you to arm everybody in the hospital now because there was an active shooter. That's not how it works. But that's what a lot of the challenge is how do we ensure patient safety, family comfort, staff safety. It's a facility. We got to make sure that everybody's staffed. We had the unthinkable event happen in that facility, and we need to make sure that we've got an operation that can manage that, but at the same time, mindful of those that we serve and how disturbing that might be. And I thank NAMI, because as much as they didn't make it easy, that's your job, is to make sure to say, hey, if you're going to do this, you have to do it right. And I will tell you, right, like we had many of a difficult conversation about it.
Yes, as much as we sit here and talk about, how well we work together, there are times that was an instance where I had to say, I'm sending you a letter and copying in the governor. So, and to share our concerns that came from our board and our membership, and that voice of lived experience. And I realize those are contentious moments, and that's part of the dynamic tension in the relationship. You have your role, and NAMI New Hampshire has our role, and sometimes our role when we're advocates is to nudge. And I will say that we were incredibly grateful, and I want to recognize again that your leadership, the team at the department, and also at New Hampshire Hospital, and their willingness to engage in these conversations and to have a series of conversations with some of our folks, people with lived experience, family members as they develop their security protocols. And, I think that really shows to all of us at NAMI New Hampshire how committed you are at the department to this collaborative relationship and to making sure that we have the best system possible to address the needs of folks who are experiencing sometimes the worst times of their lives when they have to go to New Hampshire Hospital.
And so I would say it would have been so easy for me to say, hey, these are the recommendations we got from safety, and too bad, Susan, in your letter, we're not doing it. But that's not what we did. We leaned in and we followed up,
folks.
We leaned in and we made it work. And I think that should give you hope, and anyone listening, give you hope that at this point in time, I think leadership is aligned. So we may not agree on some pieces, but we agree on the end consumer, the person, the people that we're serving is what's most important, and making sure that we do that in the best way possible. And that has the biggest impact as possible. And so I think we'll continue to do that. I think, when I look about moving ahead, which is a little bit of where Susan and I want to talk about next, we do ask our stakeholders and our partners of, when we think about with Mission Zero, we have to keep steady on that path. So those system improvements need to be sustained. But then it's also to say, okay, tell us where else there's some pinch points here in the system that we need. So I will just share with you, I think we've heard it loud from NAMI and from others, and we fully agree the children's behavioral health wait list is something that we will be focusing in on next. So I guess I would say to you is that we have the formula, the secret sauce of like, how do we get things done? So that we sort of put that process and that lens onto everything that we do. So I don't know if you want to say anything about.
No, I think that, you know, there's clearly been a real commitment, I can attest to, in our meetings around, you know, working to address the issues around particularly the children who are boarding, because currently Mission Zero is focusing on adults subject to an involuntary emergency admission petition. I will say that I was in a meeting where I heard some very encouraging news since Dartmouth has taken over the lease at Hampstead Hospital, that they have been able to start staffing up at a much faster pace than when it was the state having to do that work. And so that is really promising, that and the renovations, because as you say, the bones are there in terms of capacity, physical capacity in that space, but having that workforce capacity and having, of course, modern space that is clearly safe for everyone involved will, I think, bring us to that point where, you know, we will hopefully be able to clear that queue for that wait list for kids. But then the other piece is the investment in the children's system of care.
Yes.
Because we don't want kids to wind up in the hospital.
Exactly.
And I don't know if you, in the few minutes you have left, want to, now she's going, you didn't say we were going to talk about this, Susan.
It's not on your list, but I'll talk about it.
You want to talk about, well, their commitment to that broader system of care for kids.
Sure. And so just to go back to Hampstead for a minute. So I just want to be clear with everybody. It isn't about building more beds and that's going to solve the issue, because clearly it's not. But bed capacity for high acuity is definitely something that we're looked at. And that's what I feel hopeful about with Dartmouth, is that diversified programming, right? So you may have kiddos that need higher level of care, but it may not be an inpatient bed. It might be an outpatient service. It might be a PRTF, which is our residential treatment facility that we have within Hampstead, which is being revamped as well and improved. It's all the other parts. So that's just placement. When we talk about Hampstead Hospital, children's system of care is multi-pronged with lots of different entry points. And the point of the children's system of care is to be able to provide, again, the right services at the right time. We made an investment at the department to be able to reassess. The system's been up now since like 2018, and it's time to start to do some of the edits and the tweaks and the revisions to the system. The budget, of course, forces us to do that as well, and we're looking at some of our budget constraints, but really looking at where do we make those, where are the pinch points, where do we make the investments, where do we make the improvements. So we actually just did a recent assessment of the overall system and partnering with NAMI and other stakeholders as well, as about where we're going to go with that. So clearly, I just want to be clear, it's not just about placement at a high end. It's about making sure that kids get services in communities. Kids can be in home and get services. They don't always have to be out of home. So we'll be focusing on that. But if I may, because I know there's 2 minutes left, and I just want to go to the budget just for 1 second. If I've learned anything, it is the power of your voice. So no matter who you are that's on right now, you may be a provider, you may be a parent, you may be a patient, you may be a clinician, anyone that's involved. You know, we're up against some really challenging times right now on a financial level, not just on the state level, but on the federal level potentially as well. There's the department is grateful for all the folks that come out to our budget hearings and our budget work sessions. We're going to need you now more than ever to be able to, once cuts are proposed by both sides, to be able to talk about what are those real-time impacts. The department clearly is one voice, but we are a state government agency, so our voice is limited. And the power is really from you. The power of what the cut means is really from you. So I don't know what happens at the end of the day with the cuts. That's really up to the legislature. But what is our responsibility is to be able to be very clear what that would look like if that happens. So I would thank you in advance for considering contacting your legislator, paying attention to what's going on with some of the behavioral health services, so that we can work to try to keep up maintain the good and sustain the good work that we've been doing together. And I will say that I was going to caveat, even with cuts, we will still do this work. We will still carry forward. We will still persevere. Just maybe with a little bit less money, but we will do that.
Well, and thank you, Commissioner, and we will continue to be nudges and continue to raise our voices and advocate for this work to continue and frankly to grow. It needs to continue to grow. So together we will grow. I know you have to leave, so I will attempt to answer any questions, and if there's some that stump me, we promise we will send them to the commissioner an email and get a response and be able to share that out with folks. So
Great. Thank you so much for having me,
Thank
and
you.
I hope the rest of the conference is fantastic. I know it will be.
good luck with your governor and council meeting.
Thank
So
you. Bye-bye.
I'll slide over here so I'm more centered. And so thank you so much, Commissioner, for joining us today. And you will hear the door, folks, as she leaves, because that's unavoidable, but don't worry about it, Commissioner. And I did want to reiterate that, you know, this is indeed a challenging time. It's a challenging time for many folks, as we know. We certainly know that we have significant concerns with the state budget, as well as at the federal level, and changes that are happening, impacts to federal funding, possible potential changes to Medicaid funding. And so just wanted to give you a little bit of ideas of things that you might do. One is, if you haven't signed up for NAMI New Hampshire's public policy alerts that come out usually every Friday, unless there's something even more urgent and they come out more often, you can do that on our website. So please sign up, and that will give you an update as to what's coming up the next week. What are things that we need your voice on? And it's primarily focused at the state level. As the commissioner mentioned, currently the House Finance Committee is working on the budget for Health and Human Services. That is happening through House Finance Division 3, the subcommittee, and that will go to the full Finance Committee, and then it will go to the House to be voted on, and then whatever they pass will go over to the Senate to be worked on. There are significant cuts that are being put forward currently by House Finance Division 3 that will have serious impacts across our mental health system if they were to be enacted. Again, this is a process, folks, but we need to start raising our voices. I know many of you came out for the Finance Committee hearings, you sent in your testimony, you reached out to your legislators, and I'm going to tell you that the work isn't done, and we need to continue to raise our collective voices. If there's nothing else I know about our NAMI New Hampshire family, you are fierce and you are fighters. And that you, when it comes to, you know, advocating for people with mental illness and families, there is no one who has more heart and passion. And I am asking you to all dig deep at a time when I know it feels really hard, and see us through this process. Please make sure you convey to your legislators how important this work is. In particular, we talked about some of the elements of Mission Zero, the landlord incentives that help folks who are stuck at the back door of New Hampshire Hospital, who don't have an appropriate place to go in the community, that they can live in an apartment in the community through this program. That program is one that may very well see some cuts as things are moving forward here. A number of other places that we've talked about in terms of supporting the Mission Zero work are indeed at risk. So we want to ensure that we make sure our legislators, our policymakers know what our priorities are as their constituents. So feel free to reach out, email us at advocacy@naminh.org if you want more information. And then at the federal level, I want to talk a little bit about what's going on there. You may have heard there's been some stuff in the news. But in terms of what I really want to focus on right now are the potential threats to Medicaid. We know that there are conversations happening at the federal level from our colleagues at NAMI National, and that could have dramatically negative impacts on Medicaid, which of course then impacts those services here in New Hampshire. So NAMI National has begun a campaign to protect Medicaid, protect mental health, where they are collecting stories. As of a couple of weeks ago, they had collected 80,000 stories from across the country. Please, if you have not yet shared your story, please do so. And so that we can use that at the federal level to advocate. And then I also, if you have stories here that you want to send to us through advocacy@naminh.org as well, so that we can use at the state level, because we are also very concerned, as I said, with this budget, we're concerned about Medicaid. in this budget cycle. Particularly, there are talks about premiums, increases in prescription copays, and there also our Medicaid expansion. The Granite Advantage program is one that has in it a trigger mechanism. Should the federal government change their match, which is currently a 90% to 10%, so 90 cents on every dollar that comes from the federal government for that program, New Hampshire's law says that the program will sunset within 90 days. So we need to protect Medicaid both at the federal level, but here in New Hampshire, and create whatever bulwark we can here in the state to keep people, keep Medicaid available. We know how critical it is in terms of the overall health of our state, but especially for people with mental illness and substance use disorder. So tonight, after a long day, I'm going to be moderating a panel with our partners from other organizations here in the state, from New Futures and UNH Law, and I'm going to forget them all. That is this evening, and that is from 7 to 8 p.m. You can register for that, and I believe there will be a recording. We had, as of yesterday, well over 300 people registered for that webinar. So please, if you or a loved one or someone you know is reliant on Medicaid, I encourage you to join that webinar this evening or registering and follow up with the recording. These are issues that impact us all. They impact my family. You know, I have a loved one who has just recently, due to circumstances beyond their control, had to relocate and is currently relocate back to New Hampshire and is currently looking for work. But my loved one lives with a serious mental illness, so is currently going through the process to apply for Granite Advantage. And, you know, that is an incredibly important safety net for someone in those circumstances. So please check out our public policy alert. Certainly share your stories with NAMI National, share them with us. And if you're able and interested, please join the webinar this evening. Michelle, do we have any questions from folks?
We just have two right now.
Okay.
So the first one is, we are working on a crisis stabilization unit for Cheshire County. How do we access the federal funding? We're working on the program and location and are looking at how to fund it.
Wow, that's a great question. And I think one that's probably going to, I think if we could grab your name and email address, let's follow up with that. Given all that is going on at the federal level, and information that I learned this morning about some federal grants, I don't have an immediate response for you. Things are pretty fluid, but I do think perhaps if I put my head together with the commissioner and her team, we could follow up with some more information. So always happy to connect with folks directly and have those conversations.
And I don't know if Michelle Wagner wanted to, I have a little note that says she would like to answer that question. Michelle, do you want to address it, or should we just table that for now?
Table that for now. Thank you.
Okay, perfect. So then the next one is, how does NAMI New Hampshire policy alerts overlap or coordinate with New Futures advocacy emails to contact legislators?
So we work closely with New Futures. They have a much broader mission focused on healthcare, early childhood, childcare, variety of things. So there are sometimes overlap because they do some children's behavioral health policy work, and certainly that healthcare policy work. However, ours are very focused on NAMI New Hampshire's mission. You know, we're a grassroots organization working to improve the lives of all people impacted by mental illness and suicide through support, education, and advocacy. So you will find there's a little bit different perspective, and we don't separate. You may see on New Futures, you can sign up sort of by what they call campaign or topics. Ours is really, it's we do one public policy alert. So it's a little different in terms of what the information you'll receive. There are times you will get the same information because we do have the same goals.
And it looks like that's it. So do you have a few last words to wrap up before I, oh, well, no, hold on. In addition to the overall fears, my greatest fear about the proposed cuts to Medicaid funding is how they will affect the basic operations of community mental health centers. Is this possible?
Yes, it is very possible. Medicaid is the largest insurer in the state. Significant cuts to Medicaid will have dramatic impacts across our entire healthcare system, but especially our community mental health centers. So it is an all hands on deck moment. And with that, I want to say one thing I forgot to say earlier and ask Patrick to drop a link for folks who do have a child who is boarding an emergency department. As I said, Mission Zero is focused on adults subject to an IEA petition. Thanks to the support of the New Hampshire Charitable Foundation, NAMI New Hampshire is able to provide family peer support for parents or caregivers of kiddos who are boarding. And that can be coming to meet with you in your community, doing it virtually over the phone. And we hear from families all the time about how isolated they are and what a difference it has made to have that support. And interestingly, several parents who are providers working in the field who say, and I suspect for a lot of our NAMI New Hampshire family won't be surprised to hear this, say, how on earth does anyone else navigate the system when I'm finding it so challenging? And, you know, please share that information about the family peer support for parents and caregivers of kiddos who are boarding. We know it's a really challenging time, and whatever we can do to help folks get through that, we absolutely want to do that. And then again, I just want to say how much I appreciate all of you. And I have a favorite quote that I don't have in front of me, but in essence talks about hope is not a lottery ticket that you sit on the couch and clutch. It's a fire axe you break down doors with in an emergency. It should shove you out the door. It should cause you to take action. So as we work to hold on to hope for each other, I think we need to consider ourselves shoved out the door, folks. And I'm really grateful to be shoved out that door with all of you. So thank you.
Thank you so much, Susan. And as I maneuver things around here to share my screen, I will wrap it up. You've got lots of hearts and love coming your way after that presentation. It was really great to have you and the commissioner sitting together. I think you both did a fantastic job. So hopefully now you see my screen being shared. And thank you all for joining the welcome session this morning. Next up at 10 a.m., we have Leah Rothschild, who will present Individualizing Hope, a person-centered approach to supporting people with mental illness. Please be sure to review all of the amazing sessions we have prepared for you today, including our afternoon keynote presenter, Kim LaMontagne, and a short presentation from New Hampshire Governor Kelly Ayotte. We are also offering a new opportunity this year during our lunch hour today. It's a virtual expo, and it will be open for short presentations in a more casual setting. Unfortunately, one of the ones that we had planned on having this afternoon had to be canceled. Our presenter is sick. So you'll see on that one, it does say canceled. So make sure you check those out. After the NAMI Walks New Hampshire session, I will help you get into the expo with some screenshots. Please keep an eye out for the evaluation that will be emailed to you at the end of the conference. We appreciate your feedback on this session and the whole conference as a whole. If you need a certificate, you will be able to download one after completing the survey. Also, all recordings of this session and all of the sessions for the conference will be available later this week on the NAMI New Hampshire website and YouTube channel, or maybe next week. It is Wednesday. So thank you all for being here, and we'll see you at our next session in 15 minutes. Thank you.